If you're currently pregnant, there is actually a legal mandate in 31 states that says that you should currently know about this. So I'm so excited that you're here with us today so that I can explain it to you. So what I'm talking about is the fact that you can freeze your umbilical cord and placenta for its stem cells to use for potential future disease treatment. So here's how that works and what you can potentially use it for. Essentially, after birth, the baby comes out with the umbilical cord attached and the placenta on the other end. And because the umbilical cord has blood running through it that creates a baby over the course of 9 months, it is really rich with stem cells, which are essentially like blank cells that can be used to replace and repair damaged cells. The placenta is really rich with these stem cells too. So essentially what parents have started to do in the past 30 years or so is actually freeze these stem cells right at birth to potentially use for future disease treatment in the family. So my family always wished that we had done this because when I was 3 and my younger brother was 1, he was in a near drowning accident that ultimately gave him cerebral palsy that was extremely low functioning. So my younger brother went from being totally healthy, chasing each other around the house, to all of a sudden not being able to walk or talk or have the potential to even eat on his own. We had to look into a G-tube, and ultimately my mom was looking for anything that could help to better his quality of life, and she found that one really promising solution was a clinical trial using stem cells specifically from an umbilical cord to treat the cerebral palsy. So it basically works like a blood transfusion where they insert the stem cells into your system, and over the course of even just weeks, children with cerebral palsy were able to see improvements in their motor and social skills. These children with cerebral palsy were going from not being able to voluntarily move their feet at all to suddenly being able to wiggle their toes individually, and the stories go on and on. The exciting thing about stem cells from the umbilical cord and placenta is that it's not just used for cerebral palsy, but there's so many other families like mine that end up searching for stem cells to use or using their own stem cells that they froze at birth in order to treat heart failure, Crohn's disease, neurological and immune disorders, acne scars, leukemia, and there's early research looking at autism and type 1 diabetes. It's also being used for CAR T cell therapy for folks with cancer and immune cell therapy. And the list goes on and on. However, when it came to trying to find stem cells for my younger brother, we ultimately could not find someone else's to use because if you're a person of color or mixed race, it's generally really difficult to find a stem cell match. So in those cases, it's best to actually have your own stem cells readily accessible at birth. So the ultimate scenario for my family would have been that my parents either froze mine or my younger brother's umbilical cord and or placenta stem cells so that he could have used it. So we were out of luck when we were looking for a match to treat his cerebral palsy. I have never wanted any other family to face the same situation that mine did, so I ultimately founded Anja Health in memory of my younger brother when he passed away. His name was Andrew, hence the name Anja. So at Anja Health, we help pregnant parents freeze stem cells from the umbilical cord and placenta to use for potential future disease treatment, and we have now helped over 1,500 parents do so. We've even had one parent use the stem cells for an older sibling that was diagnosed with autism. We really pride ourselves on being one of the few banks to allow you to also store stem cells specifically from the placenta, not just the umbilical cord. And we also pride ourselves on our amazing customer service that's offered 24/7 and our premium processing at our lab. But don't just take it from me. You can hear it directly from parents. For instance, Arian Mills said, Anja Health was so easy to work with and continues to be a great company. Anytime I have ever had questions, I've been able to contact them. The owner herself has contacted me on several occasions when I had questions. That's me. I'm always here for you. And I appreciate the time and care they take. They are so passionate about it. I continue to see so many testimonials of people who have used their baby stem cells to treat various diseases, and it brings me so much peace of mind to know that should my son need it, it will be available to him. I myself have an autoimmune disease that I pray he doesn't get, but if he does, I plan to use his stem cells to help treat it. And she included this really cute photo of her son in this penguin outfit, so shout out to Arian Mills. Miria Mondragon also said, love this company so much, gives me the assurance for my baby's health. I am banking both stem cell cord blood and the cord itself. The whole process was so easy, and the person picked it up within 2 hours of me calling. They were so kind enough to even give me $50 of Uber Eats, which was a saving grace those first weeks of postpartum. Never met a company that cares so much about the cause and the people. Will definitely be doing again for my next baby. So we always send gift cards of Uber Eats to parents that let us know that they're having a particularly difficult time, or if there's anything that is on our end causing an inconvenience, we will always make sure to make up for it. And we love Uber Eats gifts because postpartum, we feel like the best thing that parents can have is a readily available source of healthy food. Lastly, Grace Sterling also included some amazing photos of our kit as well as her baby, and she said, I am so glad to have found this company. Not only do I feel so much security knowing my little boy has has an extra insurance, so to speak, this company has been absolutely fantastic to work with. I was able to speak one-on-one with their founder and CEO, Kathryn Cross, when I first ordered my kit. She was fantastic to chat with, and the company overall has been amazing. They're incredibly transparent and answer my questions quickly and completely. After putting in my pickup request, they were there in less than 2 hours. Overall, I had and continue to have amazing experiences with this company. I am a young single mother, and doing this for my little boy was so important to me. I would not have been able to access these services if not for their flexibility. I recommend Anja to all my friends and family and will continue to use them for any future babies I might have. We also have some amazing video reviews from other parents that I have personally interviewed to follow up and ask them about their experience. But shout out to all of our parents. I try to run our customer service at times in order to stay close to parents and get their feedback constantly. But we also have an amazing customer experience team, Taylor, Maria, Jess, and more, that's able to always answer your questions so you're covered 24/7. We've also had the pleasure of working with OBGYNs in all 50 states, and we have some on our medical advisory board as well, so I wanted to share what they have to say about Anja Health. Dr. Allison Rogers, an OBGYN based out of Chicago, who also has an amazing TikTok following about fertility, said, "I banked blood for each of my 3 kids, and it's so nice to know that I have it." Likewise, Dr. Jisen Chang, an OBGYN who used to work at Cedars-Sinai and is now head of business development at Billion to One, a genetic testing company for babies, said, "I felt like cord blood banking was one thing I could do as an insurance policy so that God forbid my child were to have a devastating diagnosis like leukemia or lymphoma and needed a transplant, that they could get a transplant themselves." And lastly, we also have words from Dr. Matthew Guile, who is an OBGYN at Cedars-Sinai as well and has collected for us multiple times. "Collecting with your kit was seamless, no problems whatsoever. I actually think it's hugely beneficial to store cord blood, not only for treatment of metabolic diseases or leukemia, but for things like spinal cord injury, autism, cerebral palsy, hypoxic ischemic, encephalopathy. The research is really impressive. Who knows what the next 15 years will bring." He was also on our Anja Health podcast saying more. So if you're currently pregnant and considering using Anja Health to freeze your baby's umbilical cord and placenta, here's a quick rundown on how it works. Number 1, you can essentially order an Anja Health kit on our website. You can choose what options you want to store prior to getting the kit, but you can also change your mind up until the kit arrives at our lab after you give birth. So I assume that you're currently at this point. So here's a quick breakdown of our options. So there are essentially 3 different things that you can potentially store: the blood inside of the umbilical cord, which is really rich with hematopoietic stem cells, the cord itself, which is what's called the cord tissue, and then also the placenta. The cord tissue and placenta are really rich with mesenchymal stem cells, and hematopoietic stem cells, which is in the cord blood, is inclined to blood regeneration, whereas the cord tissue and placenta stem cells are made of mesenchymal stem cells, which are inclined to tissue regeneration. So ultimately, our most popular option is to store stem cells from all 3 because you get the greatest volume and variety of stem cells. So once you pick your plan and order your kit on the Anja Health website, we will deliver it to your home within 5 business days or less. If you're giving birth more than 10 weeks from now, we will wait until you are 30 weeks pregnant in order to send your kit. If you're giving birth really soon, we can also expedite your kit at no cost in order to make it in time. We've even had parents that have ordered when they're already 4 centimeters dilated, and we still get the kit to them in time. So no problem about your timeline. Once the kit arrives at your home, you can set it aside in room temperature and make it a part of your hospital birth bag. Then you can bring it with you to birth, let your physician know that you have it, and your physician will use all of the tools inside of the kit to collect your umbilical cord and placenta. OBGYNs have generally done cord blood banking before, and they are indeed familiar with it, but you can simply stand up one of our instruction panels to remind them that you are doing cord blood banking so that they remember to collect the umbilical cord and placenta right after birth. Afterwards, you can scan the QR code on the outside of the kit in order to place a pickup. You can either fill out the pickup form or call us to place the pickup, and we will come pick it up from anywhere in the United States within 12 hours or less. And typically, if you live in an urban area, we will pick it up within 4 hours or less. Then we will bring it to our lab based in New Jersey so that your stem cells can be processed and frozen to be used in the future. Then, if a family member ever needs a stem cell treatment, you can just reach out to us through your Anja Health parent portal in order to let us know that you are wanting to use your stem cells, and we will coordinate with whatever physician is overseeing the treatment to send the stem cells to them. We have done this before. Then your family member's life can potentially be saved by your baby's umbilical cord and placenta, which is wild. We are so lucky at Anja Health to ultimately be supported by some of the best investors in Silicon Valley, including Alexis Ohanian's fund 776, and he and Serena Williams ended up actually banking with us for their most recent baby. We're also backed by Y Combinator, the best startup accelerator in Silicon Valley, and I got Forbes 30 under 30 in the consumer technology category for Anja Health. So if you're not convinced yet, why is Anja Health ultimately definitely the best option? Well, first of all, we are one of the only cord blood banks that allows you to not only bank stem cells from the cord blood and the cord tissue, but also the placenta. Most placentas just get thrown away and incinerated, so you definitely don't want to do that. So you may as well take advantage of the amazing life-saving potential that your placenta has. Additionally, Anja Health works with a lab that has over 40 years of experience in the blood processing space and has dispatched over 200 samples of cord blood stem cells to be used for future disease treatment. Because our lab director is an AABB accreditor and has so many years of experience in the blood processing space, he has helped us cultivate an amazing processing system for the stem cells that we store in our lab. It's called Cryogenesis Max. Essentially, we isolate and expand your child's stem cells, and we do it by hand with our amazing lab technicians in order to maximize and personalize the stem cell count that you get out of your umbilical cord and placenta. We are able to get up to 25% more stem cells than average cord blood banks because of this approach. We also have a lot of accessible information, and parents often tell us that they choose us because we have the Anja Health podcast with various OBGYNs, labor and delivery nurses, midwives, doulas, and other professionals in the neonatal space. We also have 20-year and lifetime storage options so that you can choose how long you want to store your stem cells and be flexible with payments. Lastly, we offer 24-hour support, as mentioned, and we've gotten amazing reviews about our amazing customer service. Now I'm going to go over some frequently asked questions by pregnant parents. So number one, can you do delayed cord clamping and cord blood banking? The answer is always yes. There is some confusion around this typically, and some providers even don't truly know the answer because it's generally up to the cord blood bank, what kind of policy they have. But with Anja Health, you can indeed do delayed cord clamping. We recognize the importance of your baby getting that iron boost at birth. So we are compatible with up to 2 minutes of delayed cord clamping, and then you can store the rest of the cord blood. Additionally, if you'd like to do more than 2 minutes of delayed cord clamping, you can still store the cord tissue and placenta with us so that your baby can get cord blood. This is another reason why it's so amazing that Anja Health is one of the only cord blood banks to offer placenta banking options. Another question that we often get is, are we compatible with placenta encapsulation? Our lab requires receiving the whole placenta, so unfortunately we normally ask parents to choose between placenta encapsulation and placenta banking, but generally I encourage parents to remain aware about the potential side effects of placenta encapsulation, as the CDC actually discourages parents from eating their own placenta and turning it into pills, etc., because it can potentially cause infection for you and your baby. Another question that we often get is, what can you do with the stem cells? Cord blood, tissue, and placenta stem cells can potentially be used to improve motor skills in children with cerebral palsy. There's early research looking at reversing type 1 diabetes. It can promote protective effects on hair loss. It's shown promise as heart failure treatment and for HIV. Significantly improve symptoms of Crohn's disease, which is a really severe form of IBS. Treat neurological and immune disorders. Treat acne scars. Treat leukemias and lymphomas. And promote CAR T-cell therapy, which is an immunotherapy that fights cancer. Cord blood stem cells have been used for immune disorders like SCID, DeGeorge syndrome, leukocyte adhesion deficiency, and there are over 1,000 clinical trials looking at other use cases. 58% of all clinical trials using just cord blood are in oncology, aka treating cancer. So this is specifically leukemias, lymphomas, and cancers of the brain, breast, and bladder. 7% of clinical trials are looking at cardiovascular disorders, including congestive heart failure, myocardial infarction, critical limb ischemia, heart disease, and others, and 6% of clinical trials are looking at musculoskeletal disorders, including spinal muscular atrophy, osteoarthritis, muscular dystrophies, cartilage defects, bone fractures, and more. And truthfully, this list has expanded even in the past 10 years. So imagine what could potentially happen in the next 10 years when your baby is more grown and might even need these stem cells. Another common question is, what do OBGYNs think about this? And truthfully, there are 31 states where there is actually a legal mandate or recommendation that your OBGYN has to inform you about cord blood banking before birth. So usually these laws were put into place when a parent was not informed of cord blood banking prior to giving birth and then ended up having a baby that needed a stem cell treatment. And so they advocated for themselves to create a regulation or recommendation in their state that OBGYNs should inform parents about this before they give birth. This is generally what OBGYNs think about this. They do indeed encourage it and are regulated usually by law to inform you of it. But if you live in one one of the states where there is not one of this regulation, there are generally OBGYNs that have done cord blood banking before and have thoughts on it. So what happens if you don't bank cord blood, cord tissue, or placenta stem cells? Well, you will have to try and find a random donor's cord blood, but the chances of survival are much higher if your donor is a relative, especially according to this study in the New England Journal of Medicine. Overall, the average chances of survival are much higher if you are related to the donor, and this is because there is a higher likelihood that there is an HLA match and a lower likelihood that you develop host versus graft disease, aka where your body is rejecting the stem cells, and in a similar way to where your body is rejecting a transplant when it receives a new organ. Because of that, I think in a perfect world, everyone has their own baby stem cells readily accessible so that any family member can potentially use them. And if the baby themselves is using those stem cells, there is no risk of host versus graft disease and receiving a stem cell treatment because it is a 100% match. If siblings use these stem cells, they are a 75% match, and if parents use the stem cells, they are a 50% match. So ultimately, the best and most accessible option is for you to have your own stem cells banked. Plus, it can be extremely costly, upward of $100,000 if you try to find a donor. And like I said, if you're a person of color or mixed race and you try to find a donor, it can potentially be really difficult. For instance, my family is half Chinese and half white, and we were not able to find a donor for my little brother when he needed stem cells to treat cerebral palsy. Because we did not save mine or my younger brother's stem cells, we were ultimately out of luck, despite the fact that research is constantly advancing around using an umbilical cord to help treat cerebral palsy. A patient's probability of finding a donor's cord blood ranges anywhere from 29 to 79%, and the highest percentage is 79%, so there is still a 21% chance that you do not find a match, even if you are white, which is the most probable category to find a donor. However, it can be as low as 29% if you're Black and even lower if you're mixed race. So if you're currently pregnant, I would highly recommend getting an Anja Health kit for all of the aforementioned reasons. As mentioned, our most popular option is to store stem cells from all three, the cord blood, the cord tissue, and the placenta, because you get the greatest volume and variety of stem cells to potentially treat disease in the future. And our most popular payment option is our down payment option, where you pay 20% down and then pay the rest through monthly payments over the course of 8 years, but it does not extend for the entire duration of your storage timeline, so you don't have to pay forever, unlike other cord blood banks. So get your Anja Health kit now.